My name is Maggie Hyman. I'm 29 years old. I am actually a dentist. I've been out practicing for 2.5 years now, a little over 2.5 years. Graduated from UMKC here in Kansas City, class of 2018. So what brought me here initially was jaw pain, limited opening. I have been having issues, and then in talking, I had headaches really since I was as young as I can remember. Definitely a teenager, early teenagers. Whenever I remember starting, my mom took me to doctors, and it was just like, oh, here's this pill, something, something. And anyway, never really a resolution, but that's just something I've kind of dealt with in early college. I started getting like what I would consider like actual migraines that made it hard to get out of bed, sharp pains. I actually went to a chiropractor, and the migraines, like sharp pains, went away. But in really thinking about it, I pretty much live with a headache about every day. Nothing severe, just knowing it's there. I would say very moderate discomfort, but it's all the time. Can make it just annoying at work as I'm sitting there trying to work on patients and you have headache, pain behind the eyes. Yeah, so that's kind of what I've decided is my number one thing. But the jaw pain, now it's right here. Whenever I try to open it all, I have very limited opening. Anytime I try to eat, it's like very severe pain, makes it very difficult to eat. Can't eat very crunchy foods anymore. And like I said, just trying to open is difficult. So that's kind of my next big thing that's brought me here. I'm hoping to figure out something to get my jaw pain down, hopefully open, can eat normal foods again. So whenever I was, I don't know, 12, and your parents are told to take you to an orthodontist for them to look at you, see if you need braces. I remember them specifically saying, oh, she needs headgear. This was before I was a dentist, I didn't know, and they were like, she needs headgear. To me and my parents, I had a little gap in my front teeth, so we were like, we think headgear is excessive, we're gonna get a second opinion. Got a second opinion, and they were like, oh yeah, we can just put a retainer on or close the gap. That's the end. So I did that, and then as I was in dental school and learning, jaw relation things and teeth, I was what people call a class 2 occlusal. Basically my front teeth tilted in and my jaw is like set back, like profile wise. So in dental school, I was convinced to go through orthodontics. And then whenever they opened my teeth, I had what would be considered a really large overjet. So then I was convinced I had what's called BSSO surgery, where they go in and cut my jaw and then move it forward. And I was told this would help. I needed this to help prevent me from having issues later. I don't know. We don't learn enough about, as I've learned from Dr. Raman, we learn enough about like our jaw joints in dental school. So I have been through a lot of stuff now more recently. Since that surgery, that's kind of whenever I feel like I got my full range of motion back, was able to eat, but I did notice like every time I tried to open, getting a little catch, and once I would kind of work it out, it was fine, I could open. And it was just like 4 months ago, I think, that I woke up one night in the middle of the night, and ever since then I haven't been able to open, and now I've been having severe jaw pain. So I think there was kind of some stuff that led into it, and then just recently has it gotten really bad to where it's making a lot of things hurt. So for my third one, energy. So in talking to Dr. Raman too, I've just, I feel like I wake up tired every single day, pretty much. I kind of wake up at work and then I hit about a midday slump again and I'm tired again. I feel like I've lived with it. I was telling Dr. Raman, I used to be fun. Now on the weekends, I spend my time staying at home, trying to catch up on sleep and stuff. I don't really feel like going out and doing a whole lot anymore. So during the week, I have to set my alarm. I set an alarm every day. I hit snooze until the last possible minute, get up, head out to work. I have an hour and 15-minute drive to work, so I drink 2 cups of coffee on my way. So I usually am like pretty awake by the time I get to work. That's about 7:30 in the morning. 8 o'clock I start seeing patients and I feel pretty awake and fine. Then with that still probably not being like full level, like I'm not like bouncing off the walls ready to go. But then whenever I get to lunch, say like 1 o'clock after I eat, I hit a slump and I'm back my energy levels at like maybe a 3. You can ask my people at work every day after lunch. I say, this is why I don't like to eat lunch, because I get so tired, which is true. And then I leave work at about 6 p.m. and then on my car ride home, I don't fall asleep at the wheel, I promise, but I'm getting to the point where it's like I'm ready to get home and get to bed. So I start with energy. I mean, whenever I wake up first thing in the morning, I'd say my energy level is like a 2 or 3. Like it's getting there, getting my coffee. After I have my coffee, I'd say my energy level's at about a 6. By the time I get to work after lunch, I would say I'm back to like a 3, 4. But then yes, on the weekends, if I can sleep in as much as I want to, and I try to whenever I can, I'm just as tired or maybe more tired. The amount of sleep doesn't really make a difference there. It's still on weekends, it's like a 3, 4 pretty consistently until I have my coffee again and kind of go through it again. So now my last one is back pain. I get back, and it kind of goes into neck. So back pain, mainly right here behind my right shoulder blade, right there, and I can push on it and it hurts, and down. That's been going on also for about 3-ish years. I notice it more during the week whenever I am working, but it's just a sharp pain right behind my back shoulder blade, and just in moving now, I can feel like I can't really move my neck or shoulder without pain, tightness, and that goes up into my neck, which causes pretty, not severe, none of it's severe pain necessarily, but it's just, I know it's there, it's constant, it just feels tight, and whenever I do go to move it, I'll get like a tension. It's kind of like, oh, not really wanting to move my shoulder back, and then my neck kind of goes up into pain through here. So on a 0 to 10 scale, really both, well, I would say honestly back is worse. I would say that's like a 5, 6, depending, like whenever I push there, it's really tender. 5, 6, and then going up into my neck, same thing, about 4 or 5, it's just knowing it's constantly there. And like I said, tight. I want to, at work all day, people find me constantly doing this sort of thing. So it's never anything super severe, but it's knowing it's there, and it's very annoying. As you don't realize how much it affects you until now. I'm like thinking about it. I'm like, man, if I didn't know it wasn't normal to have a headache and shoulder ache, and I just thought as we get older, I'm not even old, I just thought it was kind of what happens. So I'm hoping, yes, solutions would be amazing. My name is Maggie Hyman. I sought out Dr. Raman because I was having a lot of jaw issues, and after speaking with him, realized that that was causing headaches and other stuff. So yes, I have had this fixed orthotic, I guess it's been almost 3 months now, probably, yeah. Things are much better. Whenever I first started, I was having, well, the reason I called was jaw pain, limited opening, and I was having headaches almost every day. So that was kind of my initial call in. Since having this fixed orthotic, things have been really well. I basically don't have headaches anymore. I'll have one randomly every now and then, but nothing like before. Jaw, I'm able to eat hard foods now. That's awesome. I can open wider. And I just being in the dental field, I guess I learned a lot how important that, or how much your jaw, it can affect if things are all out of whack. But yeah, headaches, much better. Jaw opening, much better. Can eat, like I said, about anything. I clench my teeth at night, so I'm still fighting that a little bit. But I was having some back pain, neck pain beforehand, and I work on patients all day, so I'll get like a sore back or neck a little bit every now and then, but it's much better. Nothing like the sharp pains I was getting. I would get sharp pains in my right shoulder blade. I don't really get that anymore. So things are a lot better. I'm very pleased. So I think I've noticed a difference. I have also started a new job that's a little bit closer to you, so I think a combination of things. But yeah, I don't feel near as tired at the end of the day. I still wake up, don't really want to get out of bed, but I also have to get up early, so that maybe that's that. But I do feel like my fatigue has gotten better as well, for sure. So headache, or jaw and headaches were kind of up there, number one. Headaches, I would say 95% better. I get them randomly, but other things can cause headaches. Jaw pain, I still get some jaw pain, but I can open, and like I said, I can eat foods. I would say like a 50%, like it's definitely not back to where I was before, but I think hopefully it will just continue to get better. Back and neck pain, I mean, I would say a good 80% better. I still get some soreness every now and then, but also that comes with the job territory too, I think, a little bit. And fatigue, I can't remember really what I said, but like 50-ish% better. I'm still tired at the end of the day, but I also work 10-hour shifts, so I don't know. I'm looking at patients' mouths all day, so yeah, but things are very good. Prior to coming here, in dental school, I had braces, and I have like what they call like class 2 jaw, and so I had BSSO surgery where they like brought my lower jaw forward. It didn't have anything to do with like my jaw. It was just basically for aesthetics and bite. But now looking back, I feel like that probably didn't help the jaw issue. I did never notice any issues that started with like clicking and stuff kind of at first, and then yeah, one night I literally clenched my teeth so hard and then I just couldn't open after that. So I think there was a lot of things leading up to then the final demise of it. But yeah, having this in here, I mean, it's helped for sure. I've noticed a big difference. So I will say I am more empathetic with my patients that have limited opening or complain of jaw pain. And basically, number one, a lot of them clench their teeth too, so talking to them about jaw exercises, things like that they can be doing at home, trying to consciously not clench your teeth. I know it's hard to do. Like it's in like where I work, I mean, it's mainly Medicaid patients, so that gets a little bit difficult too. We don't really get into big jaw stuff, but I just feel like in dental school we learned like, oh, an occlusal guard or something, and I feel like I've learned in my own experience that just makes things worse sometimes, I think too. So it is, I learned a lot for sure, and like I said, now I'm a believer that if you can get it all fixed up, then it helps for sure.